everyone, this is Hillary McElhaney. Welcome back to the Nurse Preceptor channel. I'm really glad that you're joining me today. I want to talk about some ongoing healthcare drug shortages. The updated list is on my computer right now, and I'm a little worried, to be honest with you. First of all, let me do a quick plug for my book. It's called You're on Your Own, Preparing for the Impending Healthcare Crisis. I no longer think that the healthcare crisis is impending. I think that we are actually right in the middle of a really serious healthcare crisis that no one's talking about openly. But I am hearing a lot of things from people I know who work in hospitals, and it's real, guys. It is real. I'm not being alarmist, but I'm trying to get some good information out to you so that you can start hardening your own reserves at home, get some things while they are still available in the stores, and start learning some of these skills so that you can take care of yourself at home. What is seriously going to happen when the day comes and you go to urgent care or you go to the emergency room needing something and they don't have anything to help you with? So what I'm going to do here is I'm going to summarize some of the shortages I'm seeing. I am on the American Society of Hospital Pharmacists website, the ashp.org website. I think you're going to find this a very helpful website. They update it in real time as shortages of certain medications are reported. And this is not only medications, it's also things like IV supplies and materials and medications that may be used for imaging purposes, like things that are iodine-based that we would otherwise call contrast. This document goes on for 22 pages, but I'm going to summarize. What I am seeing on this list is extremely troubling. I'm seeing a lot of IV fluids, human albumin, which is often used as a blood expander for people who are fluid volume deficit, or in other words, they don't have enough circulating blood going through their body to keep their blood pressure up and keep their organs perfused. So when we're short on IV fluids, that's a real problem because people who can't take things by mouth, either due to the fact that they're having surgery or they are extremely ill and they cannot take anything by mouth, we need to have these items available. We also need to have IV fluids available because we use them frequently to mix medications that are injected. And currently, saline and lactated ringers are both on short supply. I will say hospitals are often the last entities to actually see these shortages. A lot of times they hit the outpatient clinics, the independent doctor's offices, and dentist's office first because a lot of times what happens is these manufacturers and distributors prioritize and they send the supplies that are available to their contracted people who have the biggest contracts with them. And a lot of times that's the big healthcare organizations. So I am also seeing a real shortage of all kinds of local numbing agents or local anesthetics. So that would be things like lidocaine, bupivacaine, and ropivacaine. Those are medications that if you are having, say, a localized surgery or a procedure, I'll use an example of cutting yourself and needing stitches. I use that example a lot because it's something a lot of people come in for. If there's nothing to numb you up, you're really going to hate getting those stitches. However, if you're savvy enough as a consumer and a shopper, you may be able to find some places that actually source this to individual purchasers without a prescription. I'm not saying I advocate for doing that, but I'm letting you know that if you're savvy, those resources are available. There is a shortage of a whole bunch of medications dealing with cardiac and critical care medication. That is concerning because in a cardiac situation, like someone who's having a heart attack, having open heart surgery, or recovering from those things where they are in need of getting medications quickly through an IV to help stabilize blood pressure and heart rate, some of these medications are on shortage currently. Now, there are other options sometimes that we can work with. They may not work as well, and eventually those are going to be on shortage as well. I am seeing a ton of antibiotics on this list. That is truly concerning to me because why do people seek help in an urgent care or a hospital? A lot of times it's either because they need surgery, they have a serious infection, or they have had some kind of a traumatic injury that requires intensive care for a while. Amphetamine is on short supply. I understand people are having an extraordinarily hard time getting this at pharmacies. that is the basis of a lot of our ADHD medications, and people have to refill that on a monthly basis. So now we're having to switch over to medications that are non-amphetamine, which may not work well for the patients, but also those drugs are eventually also going to be on short supply. I'm seeing a shortage of certain nebulizers, which is troubling. We're having a shortage of apparently albuterol. It looks like there's nothing listed for epinephrine nebulizers, but epinephrine injections are on short supply right now. And that's used for critical emergencies like anaphylactic shock, severe allergies, things like that. We use it a whole bunch in the hospital and the ED setting. So it looks like there is an overall shortage in a lot of the medications that are used as sedatives, either IV-based sedatives that we use in intensive care, critical care, we use them in surgical procedures. So that's obviously concerning. There's also a very odd trend right now, it looks, toward having shortages of opioid medications. There's a shortage of morphine. It looked like there was hydromorphone and fentanyl. Now, we use all of those injections for pain management in the hospital, for surgeries, for procedures. There's a shortage of ketamine, which is also a sedative that's used during procedures and surgeries. This is not good. It's not good because people are still going to need surgery. People are still going to have car wrecks and all kinds of accidents that are going to cause them to need surgery. And it looks like we're starting to see, kind of a narrowing of what we have available to give people. Meperidine, which is Demerol, is on shortage as well, and we don't even use that quite as often. I think I mentioned shortages of steroids. There's also a shortage of diphenhydramine, which is otherwise known as Benadryl, and ondansetron or Zofran, which is a medication used for nausea and vomiting. Now, I will say, as a nurse, I have worked critical care, I've worked in post-operative settings and in emergency settings, and from time to time, there are shortages of a number of different medications. It just really worries me that these medications are all pretty critical medications, and to see so many shortages across the board all at one time does not bode well, because this is just the beginning of our traditionally busy season in the hospital, where we have a lot of respiratory illness, therefore critical care patients. So do everything you can starting right now to get yourself as healthy as you possibly can, to maintain your health, to do everything you can to avoid unnecessarily dangerous situations. Be really careful on the road driving, be really careful doing your activities outside. Make sure that you're not taking unnecessary risks right now. This is probably the last time in the world that I would want to do something crazy like cliff diving or insane bungee jumping or anything like that, because if you end up in a hospital, it looks like some of the stuff that you may need to heal is kind of running short right now. Not to be alarmist, but to give you good actionable information. Okay, so what I want to do right now is let me go ahead and end this dictation again with a plug for my book, You're on Your Own, Preparing for the Impending Healthcare Crisis. I think the crisis is alive and well. It's here right now, and you need to do everything you can to bolster your own ability to take care of yourself at home. Like I said before, one emergency room visit, one urgent care visit, and this book has paid for itself several times over. I give you a lot of essential skills, knowledge, and a recommended list of purchases that you can make so that you have what you might need at home to take care of at least the minor to moderate urgent care issues. All right. Please join me for my next video. Look forward to seeing you again. Comment below especially if you are a healthcare provider, or if you know healthcare providers who are reporting similar shortages across the board.